Musculoskeletal injuries while repositioning patients or residents are one of the most frequent causes of missed workdays for healthcare workers. Having no tool or the wrong tool for the job is often the main contributing factor. Using high-friction bed pads for moving patients or residents can mean frequent neck, shoulder, and back injuries for caregivers. The Swift UltraSlide System is a convenient and scientifically proven way to reduce exertion and risks associated with repositioning low mobility, highly dependent, or heavier individuals. The Swift Slider and UltraSlide fitted bottom sheet can be used individually or together, making the Swift UltraSlide System an easier, faster, and safer way to turn or reposition bedbound patients or residents.
It was definitely easier to use the slide system to move the patient that we had today.
It felt like there was somebody else helping you, an extra set of helping hands, helping you move a patient up in bed. It was so much easier.
The UltraSlide bottom sheet is a fitted sheet modified with a low-static, low-friction panel down the center that helps reduce resistance during repositioning. It's made of soft, breathable fabrics that support superior skin care. The Swift Slider conveniently stays on the bed at all times. You simply untuck the flaps when it's time for repositioning.
Most friction-reducing products have to be inserted before the move and then removed following the move. Nurses have multiple demands on their time every day. What they like about the Swift UltraSlide system is that it's convenient because it's already on the bed. So with the system already in place, it's ready for them to use at any given time. This makes their work life that much more convenient.
You can use Swift Slider with or without a bed pad, depending on needs relating to incontinence. The Swift UltraSlide System is available in an array of healthcare mattress sizes for standard beds, stretchers, and bariatric beds. Each size is color-coded for easier identification. The durable, 100% synthetic fabrics are easily laundered with other bed linens and dry quickly. And just how effective is the Swift UltraSlide System? Our sheets were independently tested with caregivers at 8 hospitals and are currently being used on thousands of beds across North America. Compared to the use of a standard jersey contour sheet with a standard bed pad, an independent study shows that perceived exertion is less than half when healthcare providers use slider sheets compared to traditional sheets. The slider sheet system showed 65% less friction than the traditional sheet system. Lost workdays and cost of injuries related to manual bed repositioning were reduced by almost 50% in the first year of implementation.
There's a business case to be made for investing in the products up front. The benefits to the healthcare organization, of course, is that they save money from going out to the cost of injuries.
It's going to create a culture of safety. It's safe for the patients, it's safe for me as a working nurse. It's also key the fact that I want to be working for a very long time, and I definitely think that this system is going to provide me with that opportunity.
The Swift UltraSlide System. Repositioning made simple.